I'm Andy. I'm 59 years old. I've never had a filling in my life, yet I have gum disease. I've lost 3 teeth and had 4 surgeries. What caused this? My teeth seem clean.
Okay, well, first of all, Andy, nice to meet you.
And you?
My name's Devan. I'm a specialist periodontist. I'm based in the West Midlands and central London. And it's a really good question because gum disease is actually a very complex disease. And it all starts off with the bacteria in the mouth. Now, everybody's got bacteria in their mouth. You can't sterilize anybody's mouth. The issue really arises in your genetics, the way you've been wired up by nature. And the way you've been wired up by nature means your body's very sensitive to that bacteria. So when the bacteria reaches this threshold level, which doesn't have to be very high, so we're not saying you're not brushing properly or anything like that, but when it reaches that level, your body doesn't like it and it overreacts. And when it overreacts, it starts off this process called inflammation. So inflammation is a normal, healthy response. You cut yourself, it becomes inflamed, and then it heals. It's part of the healing process. The problem with the inflammation in gum disease is, first of all, it's too severe because of your genetics. And second of all, it doesn't switch off because the bacteria stays stuck on your tooth. The body can't exfoliate the bacteria. So as that inflammation builds in the gum around the tooth, you get the early signs of gum disease. It's redness of the gums, bleeding gums, swelling of the gums. Till eventually what happens is the gum comes loose and forms gum pockets, which is what your dentist or hygienist or therapist can pick up in the dental surgery. And the bacteria above the gum can then get under the gum, at which point they get close to the bone, which holds your tooth firmly in the jaw. Your body doesn't like bacteria being close to bone. So it does the only thing it can do, and it tells the bone to start retreating. And that's when we get the signs of more advanced gum disease. We call this periodontitis. Now, if that goes uncontrolled over time, what we find is that the gums can start receding to follow the bone. The teeth can start wobbling, they can become mobile. And eventually, if it goes uncontrolled over a period of time, the bone loss can get right down to the tip of the root where it can flare up pain, abscesses, infection, and ultimately lead to loss of the teeth. Okay, so the end stage of uncontrolled gum disease is loss of teeth. So hopefully that explains it to you. It starts off with the bacteria, but then it's your body's response to the bacteria.
It does. I understand genetics has a big part to play, but are there any sort of lifestyle factors that are risk factors?
Absolutely, yeah, it's a very good question again. So there are factors on top of the genetics which essentially change your body's threshold to the bacteria. And we call them, as you've already correctly said, risk factors or lifestyle factors. And the main two are smoking. So smoking can increase the severity of your gum disease, and it can also reduce your treatment response. So the recommendation is, wherever possible, to stop smoking completely if you are a smoker. And the second is elevated blood sugars. So having elevated blood sugars or even having diabetes, if it's not so well controlled, can lead to a higher inflammatory response by your body and can promote further bone loss later down the line.
Okay, so smoking's not good.
Yep.
But the NHS at the moment are trying to convince smokers, if they can't give up completely, to switch to vaping. What about vaping? What do we know about that?
A lot of good questions there, Andy. So vaping. The current public health guidance with vaping is it's better to vape than to smoke, and vaping can help a smoker transition off cigarettes. Okay, the issue with vaping is it is a relatively novel kind of habit, and so we don't know a huge amount about its impact on your gums and also treatment response. So whilst it's great to get you off cigarettes, and I would always recommend a patient that's smoking, if they need to use vapes to get off smoking, to use them, ideally the best thing is to not use either.
Okay. So how would I know that I've got gum disease?
So there are a few symptoms of gum disease, which many patients will present with. The main ones being bleeding gums, swollen gums, tender gums. But interestingly, pain itself isn't actually a symptom, or isn't a common symptom of gum disease. And actually, if you're presenting with pain, in many cases, this may mean that the diagnosis is a bit further down the line, and it may make treatment more challenging. So I would never say to a patient, wait until you're in pain before you seek advice when it comes to gum disease. And the best treatment is always prevention in these cases. So yeah.
Okay. I see a lot of adverts on television for toothpastes that are supposed to be good for your gums. Should that be my first point of call if I think I've got a problem?
I think that whilst there are toothpastes that contain medicines that can help with inflammation, the mainstay of treatment is always mechanical removal of that plaque or biofilm that's building up on the tooth surface. So plaque is essentially, biofilm is a posh term for dental plaque. So yes, whilst there are various toothpastes out there which can kind of target the inflammation of gum disease, the mainstay is to use a good quality toothbrush, ideally an electric toothbrush is what I recommend for my patients, and also interdental brushes to get in between the teeth, to the areas that your toothbrush can't get to. So the mechanical cleaning always overcomes the medicinal side of things.
Okay, so I didn't use interdental brushes until I was diagnosed with gum disease. I did use an electric toothbrush. Are there any tips and tricks as to how best to use a toothbrush?
Yeah, so I mean, first of all, we're not kind of taught how to use a toothbrush. You can't just go out to the supermarket, pick up a toothbrush off the shelf and use it effectively. Actually, we need the instruction on how to use it effectively. So the first thing that I would say to anybody is go and see your dental professional, take your toothbrush with you, because they'll be able to advise you in your own mouth exactly how to use the toothbrush. On top of that, I mean, just generic advice when it comes to toothbrush use is to focus the use of the bristles at the gum line, so where the tooth meets the gum, because ultimately that's where the problem's starting, and angling the toothbrush bristles towards the gum line.
You mentioned bacteria. So in other parts of medicine, we've got antibiotics that treat this, treat this, treat this. Is there any advance on any kind of antibiotics that will help with gum disease?
What we know is that we can treat gum disease very effectively without the use of antibiotics. And as a profession and also as a population, we've got to be very responsible when it comes to antibiotic use, because really you don't want to exhaust your use of antibiotics, so at a later stage when you do need them, they don't work. Because we know that treating gum disease without the use of antibiotics is very effective, we're very selective in the cases when we do decide to use antibiotics. And ideally, we recommend those being used in specialist centres.
So what's best, a manual toothbrush or an electric toothbrush?
So when it comes to toothbrush use, what we always say is, provided you've got the right technique and you're removing the bacteria or the plaque to the level that your body needs, then there's not a huge amount of difference between whether you use a manual or electric toothbrush. So as long as you're using it properly, it doesn't matter. Okay. What we also say, however, is that, or what I find is that electric toothbrushes are easier to use better. So where possible, I tend to recommend those.
Okay. Are there any parts of the mouth that people typically find harder to clean?
Yeah, good question. I would say in between the teeth tends to be one of the areas that many patients will miss, and that's why we recommend the use of interdental brushes, especially in patients with periodontitis. And where you can't get in between the teeth, sometimes patients have got overlapping teeth, for example, a bit of crowding, where an interdental brush won't fit in between the teeth. At that point, we would recommend the use of dental floss. So first port of call between the teeth, interdental brushes. If you can't get your interdental brush in between the teeth, then using dental floss. Other areas tends to be the back molar teeth. And on the tongue side and on the palate side tends to be quite challenging. So what I tend to say to patients as a little tip is to start off with your electric toothbrush in those areas when you've got the most energy. And then the easier areas towards the end of your brushing regime at the front of the mouth.